Okay, so why are your phase 3 trials stalling? It's the multi-million-dollar question, right? It's the one thing that keeps clinical ops directors and pharma executives up at night. You've got this groundbreaking targeted therapy. The funding is secured, the sites are ready to go, and yet the patients just aren't crossing that enrollment finish line. Today, we're looking straight at this operational nightmare. We're talking about the massive bottleneck of delayed clinical trial enrollment that is bleeding your budget and, honestly, costing patients precious time.
Just look at this number right here, 20 to 40%. That is the percentage of standard FFPE tissue samples that literally fail traditional next-generation sequencing testing simply because there isn't enough sample. Your clinical teams fight tooth and nail to find eligible patients, and when they finally do, up to 4 out of 10 times, the sample doesn't have enough DNA to actually give you a result. So you lose the sample, you lose the data, and worst of all, you lose the patient.
But hey, the landscape of companion diagnostics is shifting, and that's exactly what we're breaking down in today's Explainer. We're going to explore a really systematic solution to this exact crisis. We're talking about a breakthrough dual-platform architecture combining rapid PCR and nanopore sequencing that completely obliterates these bottlenecks. For all you clinical research folks tuning in, we're going to show you how to make your patient recruitment drastically quicker, cheaper, and vastly more accurate.
Okay, let's dive into this. We'll start by unpacking the bottleneck itself, then introduce the dual platform solution. We'll break down PCR, our speed engine, and Nanopore, our depth engine. Finally, we'll map out how this accelerates drug trials and look at the new CDX paradigm.
Starting off with Section 1, the clinical trial bottleneck and the very real cost of the wait. To truly get why this solution is a game changer, we kind of have to face the current flawed paradigm first. Traditional testing relies almost entirely on single centralized labs, right? You've got logistics taking days, lab receipt takes a day, prep takes days. The sequencing run alone is 3 to 5 days. Add in data analysis, and your clinical sites are forced into an agonizing 10 to 16-day wait just to get a single biomarker result. And let's be real, in the fast-paced world of oncology trials, a 2-week turnaround is practically a lifetime. And the hidden costs of that wait? They're absolutely brutal. As we established, it takes up to 16 days and fails on 20 to 40% of samples. But the real-world clinical impact is huge patient dropout. Patients' diseases are actively progressing while they're sitting around waiting for a profile, which often makes them ineligible by the time the report even shows up. Plus, trying to deploy this clunky central lab workflow globally, it's a total nightmare of skyrocketing sunk costs. But there is a way to break this cycle. Let's jump over to Section 2, a dual platform solution, and why it represents a true paradigm shift for recruitment. And this brilliantly illustrates the fix. Consider the insane synergy between a point-of-care PCR platform and a nanopore sequencing platform. Where sample scarcity causes traditional testing to fail, PCR steps in. It only needs a single tiny section. Meanwhile, nanopore uses ultra-long reads to rescue those low-quality samples. Turnaround time too slow? PCR gives you results in hours, while nanopore sequences in real time. They literally cover each other's blind spots, turning your testing from a huge bottleneck into a global asset. Let's zoom in on the sprinter of the setup. Section 3, PCR, the speed engine built for rapid patient screening. Now, to be clear, this is not your grandfather's PCR. This is fully automated point-of-care testing. We're talking results in just 30 minutes to 4 hours. But the absolute biggest breakthrough is the sample requirement. It needs just a single 5-micrometer section and works even if the DNA content is under 1 nanogram. No specialized lab techs needed, so you can drop it directly on site at your trial centers. It fundamentally expands the boundaries of who you can test. Oh, and it's already Class 3 registered with China's NMPA, which is a massive regulatory head start. Of course, speed isn't the only thing that matters. You still need that deep, comprehensive data. That brings us to Section 4, Nanopore, the depth engine. The beauty here is you don't sacrifice data for speed. Nanopore is our deep diver. It gives you the multidimensional profiling modern oncology requires. You get ultra-long reads on the megabase scale, crucial for cutting down errors in those tricky samples. It does direct RNA sequencing without amplification bias and direct methylation detection without destroying the sample. And with a raw read accuracy hitting 99%, this tech is totally ready for primetime clinical application. So, what does this actually mean for your day-to-day operations? Let's check out Section 5, Accelerating M&C Drug Trials, and the real business impact. So, the crucial point is comparing these two models. It is night and day. The old model forces a 2-week wait, relies on central labs, and bleeds patients.
But the dual platform model, it completely flips the script. By doing PCR on-site, you get same-day enrollment decisions. You can literally fast-fail ineffective biomarkers early on. That means you adjust trial designs on the fly and drastically cut your sunk costs.
Let me walk you through exactly how this looks on the ground. Day 0, sample is collected. Boom. Instead of shipping it out, the site runs the automated PCR screening right there in 3 to 4 hours. That same afternoon, if they're positive, the investigator makes the enrollment decision. Patient is locked in. Meanwhile, the rest of the sample goes through parallel nanopore deep sequencing over the next 1 to 2 days for your comprehensive data package. It's just so much quicker, cheaper, and more accurate. And if we look at the strategic ROI across the whole drug lifecycle, it's huge. Phase 1 and 2, use PCR to fail fast, while Nanopore discovers novel biomarkers, cutting your upfront risk. Pivotal Phase 2 and 3, that on-site screening rapidly accelerates enrollment, while your central lab ensures the data meets regulatory standards. And by the time you hit commercialization, those decentralized PCR units are out there maximizing your global market penetration instantly. Which brings us to our final stop. Section 6, the new CDX paradigm and where we're heading next. Now, what's really interesting about this slide is how seamlessly everything integrates. You've got rapid patient screening feeding directly into trial enrollment on one side, but simultaneously, that exact same pipeline feeds into deep biomarker discovery. It perfectly bridges the gap between the urgent need for quick bedside decisions and the super rigorous demands of regulatory submissions. And for long-term pharma partnerships, transparency is everything, right? These developers are totally open about their R&D roadmap. They're expanding coverage to breast and urologic cancers. They're aggressively pushing liquid biopsy sensitivity down to a crazy 0.1%. They're building data interoperability standards and actively chasing broader FDA and CE-IVD clearances. It's a platform that's built to evolve with you. But look, if you only take one thing away from this whole explainer, let it be this right here. By using this dual platform approach, you compress biomarker screening from 2 weeks down to a same-day decision. And because of that speed and accuracy, you can potentially improve your Phase 2 and 3 enrollment efficiency by more than 40%. That's 40% fewer dropouts and a fundamentally faster path to market for your therapies. The tools to actually fix this enrollment bottleneck finally exist, so the only question left for you is this. Are you ready to stop losing your patients to the 2-week wait and accelerate your global trials today? Thanks for hanging out with me to explore this breakthrough approach. Catch you on the next explainer.